some people will say some person because of over loss of job. Okay. So our ability to manage our struggles, no, ending into the hospital. And now on become be say, oh, my so went to menu medro kumi no. That is how strong you are. But sometimes, when people come here, some say, why? I didn't hear. They give you, as someone can say, it happened, no? Obi will say, oh, my boss, I can't take my boss stresses me out. She, like, he give one command and I don't finish and he's giving another command. I'm so, overwhelmed and I can't know, but at the same time, I need a job to, survive. So I'm going to job, and when I go to job, I'm panicking and all that. So they are stressed over job, but you were dealing with so many things at the same time, you manage it. So when people get so overwhelmed at whatever and they cannot manage it and they come to the hospital, then they slap them with a diagnosis. But you don't go to the hospital. You are able to manage yours at home. And as a manager with substance, the amicus or she weak akra. In the ABR or yet your friend is saying ABR or yet stress out kwa boni week akra na wa chele na okoni baby. Obi wa onum wi why so stressed oni bibia ebe chill no obi wa onum nsa oni bibia ebe calm no why so anxious, and then they end up in a psych hospital. Okay, so we all have mental struggles, we all don't have mental disorder, but struggles there, we all struggle. Okay, all right, can you suggest some of the coping mechanism? So okay, so with that being said, with that being said, na who say your mental struggles, but we all may not have mental disorder. When do people get diagnosis? Time ben ema ebi wo no ma you can say way or depression, way or anxiety, way or bipolar, way or schizophrenia, way or psychosis. So for people to be diagnosed and now to be given a label of psychiatric, disorder, first of all, it depends on the symptoms they are exhibiting. Okay, it depends on the symptoms they are exhibiting. Most times, no patient comes to the hospital. Say, what is your diagnosis? Also, they said I have bipolar. They said I have schizophrenia. And that may be someone say, do you agree with your diagnosis? No, I'm not schizophrenic. I don't have bipolar. I don't have this. I don't have that. It's these doctors, they want to put a label on me. Most patients, they say that. Most patients are who come and say the doctor said I have this, they said I have that. They are the ones who actually have the diagnosis, but they don't want to accept that they have the diagnosis, especially bipolar and schizophrenia form. Bipolar and schizophrenia form. Why am I saying that? Bipolar and schizophrenia, no. Wuni panankasa wo kra wuhu. Wuni pano wo sa yare no kra wuhu. Wo nyoma na wo ye no. Ene ebe ma obi be observe aka say, enyoma ya akwaye ase adwen no atochi ena enkoyi. The yare bi to say schizophrenia, schizoaffective disorder, bipolar, and mood dysregulation, and borderline personality disorders near the no. Nipa nankasa na or what's higher no, they don't know that they have it. They don't know. Somebody else and obeti ni observe ya ka say ni. But the yare bi to say anxiety, any depression, any post-traumatic stress disorder near the end there. Nipa nankasa na obeka krama when we say something like that happen. Okay, even though something like depression, okay, depression when obi ne hormones are nipa ne happy, serotonin ne dopamine ne ade no so suppressed, so nipa no don't have any ne post synapse ne part of the brain na as I say happy, energetic. Depression doesn't always mean nipa happy. Sometimes no be a while they are always fatigued. They be an breath on to mean sorry obeda mpemu saa. It doesn't mean say on sre obesre all right. Ebi our friend obeka say phone so obehwe move wese, but they don't even have the energy. Say first na nipa no on anti ana okọ jogging na okọ edwuma sisi ano on die but to me cry and sorry. On to me cry and sorry. They don't have that energy. Depression can be in so many forms. Depression doesn't always mean say sometimes you got depression, people say depression, they're why you say just why you depressed. Yes, your affect can tell us why you're depressed, but maybe that it's not. Sometimes no, your ABR mood be looking depressed because a mood and your ma wo yeah, you know wo that do, and I say wo did you do, and I say why isolate do, and then I will mood, okay, and I say say weninje at the same time no, but na bia wenim aye kama obi wo hwa wa depressed de bia na watwi nenim wa dress kama but unhu nenim a nenim ye kama but ni mood ye withdrawn, and I say ni mood ye calm, and I say ni mood ye depressed. Ain't eya na ye ka say affect is ni affect ye say dia nipa no nenim e show affect is the person affect congruent with the mood and just said the nipa nenim ni affect niti no and ni mood no e match ana obi wo a ni mood ni ye depressed but ni affect or smiling why you say or throw but okay say you go say oh no affect is nice, is normal expression, but the mood is depressed. Okay, and the one to mean for obi enim pe. Staphylococcus is just want to mean for obi enim and kase why depressed, even though you bet me use mood and affect I share how and nipa why depressed no. Sometimes no, we want to ask the person say, do you feel depressed? The word depressed who you saw people don't like, so we feel like do you feel it down and do you feel like you don't want to do the things that you love to do? Are you still doing things that you love to do? We put it like that. Yeah, I still do what I love to do. Okay, so are you depressed at home? They will tell you no. They will. Anybody you ask, are you depressed? They will tell you no, I'm not depressed. Because they feel like being depressed is like it's like a bad thing. But sometimes you will say, obey deny and say no, but your affect and your mood is telling us that you are depressed. Okay, so that is depression. And anxiety, so dear, most time with anxiety you can't even hide it. With anxiety you can't even hide it, because when people are anxious, you could actually see, they are biting their fingers, they are like this, they are trembling, almost show they are eyes are so dilated. They are with anxiety. When somebody is really anxious, without them even telling you, you could tell. Normal battery, they are pacing, they are like suspicious, they are restless, they can't like you could just tell that they are anxious without them telling you. And the people always say, are you anxious? No, I'm fine. But you're anxious, no more pain drone. Otherwise, I'm anxious, I have anxiety, I have this yeah. So while with depression you can or cannot see, anxiety sometimes, most times you can actually see. They can't focus on one thing. Oh yeah, they can't no way. No way, no way. No, say, are you okay? I say, I'm fine. Anxiety, no. Constantly, no. They are worried about something. There is this repeated, thoughts going through their mind, so they cannot concentrate on one thing. That is anxiety, okay? And I normal say, oh, no, you're being anxious. It's okay, exams. Okay, exams. And no matter how much I wish you there, anxiety be wo kakra. Okay, interview. When him say you're qualified, but we show kakra. And any anxiety, okay? And I say, we share brotherhood or internet so. Na internet Makasa fedi de mukwa share mu in person. Yeah, like na nipa we cry say okumisha kai mu and I say you have a little, we are a little bit, anxiety kakra ewo honum. And now kokasa nipem, okay, kokasa nipem, you are anxious. There is a little bit of anxiety ewo honum. Oh, mimpano. Okay. Oh, thank you. Makwat, thank you. Maybe I don't know where I can. Oh, okay. All right. Thank you so much. Thank you for letting me know. Internet just said me sorry for tonight. Okay. Thank you so much. Into all this while, no, people they see that nobody talk. There's nothing going on here. There's nobody here. All right. Thank you, okay, thank you. All right. So, that is anxiety. Okay. Uh-huh. And, when do people get? Oh, can you hear now? Is it better? Is it okay? Okay. All right. So, okay. So when do people get diagnosis, and when do we time ben a doctors Becca say, oh, nipa we or yare we and answer or yare we, like I'm saying, for psychiatric disorders, okay, and yet to say diabetes or diabetes ebia wo hunim wo jonso dodo wo didi dodo wo sweaty ni ade wo kwa doctor be your lab na waka say okay lab ne buy no e che say wo A1C say no diabetes, okay. With psychiatric disorders no and a mental health disorder diagnosis no, you have to show certain signs and symptoms, about more than 4 or 5 signs and symptoms of yareokono, okay, for a period of time. And sana yakajo say yare we na okay. And for psychiatric diagnosis, very difficult sometimes for people to be diagnosed. If you are to me hospital was for more than 2 weeks, now on diagnosis psychiatric observation, because we are not sure. BBC will feel they're acting funny, weird, be and I mobile. So we can really the doctor, especially say a first timer, okay, and you don't have a lot of information, you can. And sometimes doctors they have to ask. This is not a wig, okay? This is not a wig. This is my hair. Excuse me, this is my hair. This is not a wig. This is not a wig. We best say topic no. My hair is my natural. My hair is my natural. This is not a wig. Is this a wig? This is my hair. My hair is my natural. I bought it, so it's mine. It's not a wig. Is this a wig? Wig in here. Just how I best say topic no. Ain't other wig them ya Jessica. Me ya Jessica na masha wig. Thank you. Ain't you have to that period that symptoms as I said, persisted for a period of time, more than 6 weeks, and sana yaka say okay, sisi based on your signs and symptoms schizophrenia, and ade ba ko pen na obey na diagnosed with schizophrenia, as I say more than 5, okay, signs near more than 5 or 6 and sana. But maybe to say depression, nipa na beka say I am depressed. They are the ones telling you that they are depressed. Obi o say, oh, I am depressed, so no about hospital, I'm depressed. Eduane bi ade me na bia obedi. Obetimi ni nko oni ho na oni patient ni to ho on be bon ko masre ha. Yeah. Uye ni patient obi say, I'm your nurse today. How are you feeling? I'm depressed. Now what I'm depressed. I wouldn't make us we open up not day room. Yeah, and you know, oh Bob Drake, man, that show was crazy. It was late. Yet Bob Bonuma Yeshana. Yeah, besides assessment, say, how is your mood? I'm very depressed. I understand your friend is subjective finding. On one or catch on. In the wood show note as a per patient report feeling depressed. But now all the observation that was, but patient was seen in the middle, socializing with peers. Chopper, but when you ask patient mood, into your hold on our bro for the mood is not congruent with I patient mood and way it's I know dear I don't know so I depressed me when the moon maybe so I depressed and on depressed I don't know okay so you depressed or you depressed they want to discharge you. I would like to discharge you to go home. No, you can't discharge me. Why? I'm depressed. You are depressed. And about bon come over from day room one from an apartment where the way doing in ya or Jerry, where Jerry was who then I just away depressed, also a depressed, or no, also a depressed. It is a insurance bet here when I'm what now. Insurance can say, hey, for time or so I'm the single fee now coffee. Okay. Into no sometimes what the patient is what they are saying depending on the area a bit it says schizophrenia no more wa omo kasa obi eni ho no more kasa no more yeah wo guy bi o unit was say onambia no checking the pulse onambia say yeah the whole shift in ya checking the pulse na am say I need there wo there wo the way they be out checking pulse there I also in telemetry every time be out checking the pulse say yeah and no kasa no three ubizan say are you hearing voices or say I hear your voice yeah I hear your voice I hear your voice they don't want that they don't want that okay ain't no they themselves they are not aware. Most people are not aware of what they are doing. Internet a observation no so obi ohonoma obi ohonoma oba say omo yansha na anye sure na ye need a lot of background the doctors no omo brepa say patient na patient or your recurrent patient that's all you knew they have to call obi a nim patients no and obtain a lot of information because we don't really know that who diagnosis na the mama who how be treating but who nim diagnosis no a say patient was found at Walmart with bizarre behavior. That is all you know about the patient. So the doctors and the social workers will have to call maybe family members, maybe people are information just to collect the always want to know the background and son I be do baby I eba be do no one yes I'll be mistake okay that is our mental some of the mental health way. Okay, so how do people end up in a psychiatric hospital? First of all, any of us can end up in a psychiatric hospital. Any of us. Debi ameka says mikunu onim. Enyoma bi anase nsem bi ameka of a police a ebefa me akọ psychiatric hospital nanka omo de me akọ be 1 million times. Nsem bi wo wa asem keke bi wo ho no ma wo ka here in America you be over shock price. Obe kan say me over shock price we be ba ho so no. Na me te honum. Na me to say so what brought you here? Obe say wait, where am I? You are in a locked psych unit. Okay? Yes. Any of us can end up in a psychiatric hospital. I don't think diagnosis is based on when you find a patient wandering on the street, okay, and you don't know, 911 sees this patient walking in the cemetery in the night. The patient is picked up, go to the ED, end up in a psychiatric hospital. You don't have much information about the patient. Sometimes, obi owa a first time and a psychosis and as a whatever, no, it break it through. Okay, it is very difficult for you to diagnose this patient. And remember, when a patient is in a hospital, I'm responding to Obi. When a patient is in a hospital, for you to hospitalize the patient for insurance to pay, you have to give diagnosis. Without diagnosis, what is insurance paying you for? Why is the patient here? Okay, so sometimes, like I'm saying, it's not just the presentation. Listen to me carefully. It's not just the presentation. It is also the background. They will do as much as they want. They can to obtain information from somebody. They know. Because on ebi mo psychosis from substance. And draw bet me about them acutely. And draw the fuel system where you are okay, you are gone. Or you could be bipolar in your manic episode and you are just acting erratic. But if they don't really know, how are they going to treat you? So exactly. So they want to know your past, not just medical history, your psychiatric history. Because when you pick up a patient and the patient is acting crazy, you don't even know. Say, but if friend out because a patient who has a history of bipolar, then say, okay, now I know what I'm dealing with. Maybe I'm gonna start a patient on mood stabilizer. But if you don't know, and there are patients with multiple psychiatric diagnoses. So which one are you treating? What are you gonna? Because that is when. No.
Mommy,
So
open the phone for me.
Oh, no.
So,
it's actually 7 o'clock.
Mommy, you look like a boy.
No, psychiatric
Mama,
is different from
open
medical.
the phone for me.
No, I won't. You.
Mommy, I promise. I
No.
delete it.
Okay, no, I need to. I'm talking to
No.
Ain't you know, Nana Kosia, I don't know your background, but they know doctor, okay? Will just everybody wants to know patient history. That is why patient history is never, you don't delete patient history.
5,
It doesn't even matter if whatever it is not happen.
7.
Thank you, Lankita. Okay, guys, okay, how did you guys end up here? You were downstairs.
Mama. We just came to see what you are doing.
Okay, I'm doing live now. Can you go by?
Mommy, you look like a boy.
I look like a Chinese boy.
Yeah.
All right. So I don't know your background, but when I was talking, I said that they don't just diagnose a patient based on even one sign. Oh, take it back. Okay. So
I'm gonna get you.
You did not listen to me well. You did not listen to me well. I said the doctors would try their possible best to get to know the background of a patient. They would try if the social workers can reach somebody. And in the notes, they will tell you whoever they spoke with. They want to know the patient history from Oyem Kola, Oya Kola, because you can't just slap a label on somebody without. It's not just about medical record. You also want to know, because medical record, how did the patient come to the hospital in the first place? They come to the hospital because they don't live in the hospital, most of them. It happened at home and they came to the hospital. So you want to know what do they do at home? The family members will tell you, say, he stays in the shower the entire night. Schizophrenia for no. They love to stay in the shower the entire night. Ain't you know, open a family nigga say almost sewage. The sewage, they constantly have to come and drain the sewage, and as almost shower bill, almost pipe bill, it was through because so you cannot just based on information. How many times do people write false things about patient in the hospital? You want to know the background, and there is no better person to tell you something about the patient than the people who live in the house with the patient, because that is the patient, normal environment, and whatever they are doing, whether a good and as a bad, if it is bad because whatever they are doing in the home, the family member says that's not okay, so that is why they send the patient or they call them to come. Okay, so video we about psych hospital, most people don't just work themselves. I used to make us but for patients, so when listen to me carefully, okay? So now I don't remember where I got to. I got a little bit derailed, and I am. All right, I don't know where you're maybe our understanding. You don't listen. You didn't listen to me well. All right, you did not listen to me well. So I'm not gonna go back and forth. You should be reasonable and understand what I'm saying. I am talking about how people get diagnosis. So first of all, I'm talking about before I ever diagnose you obesity or depression or bipolar, or will say, well, what's it one out in hospital? Do you know the patient? You don't know the patient. You don't know the patient. So you are collecting information. So when people don't have family members, yes. People don't have family members, yes. But and you'll be as no family members. There are people that they are orphans. You get report from maybe they live in assisted living or something. So whatever it is, what I said, and say the doctors try their possible best to get background from whatever they can before they can actually try and diagnose the patient. It's not just what we are seeing. It's also the background is very important. And the background can be from school. Background can be from church. Background can be from the family. Background can be from grandmother, anybody. So police, whatever. Background is background. Okay? Okay, so, yeah. So, where did I get to? I don't remember. Lena, where did I get to? Okay, so I don't mean kai baby I do, yeah. I got distracted. Me kai how so now me can about how people, who yeah. So any of us can be in a psych hospital. Any of us. Okay, any of us. Two ways people get admitted to the psych hospital. Okay, first of all, na make up bipolar. Oh, okay. First of all, nipa nankasa be assessing who say, they are not in the right mental state. Okay, and they take themselves to the hospital. Okay, sometimes nkrofobia omo disorders be to say ADHD, and I say no battle with depression, and I say trauma, PTSD near there no. Mostly in America here, no psychiatrists, any therapists, okay, and they are already in the system. Obi wa one ma psych hospital, you won't call our units, you will in collar, and I will adults, teenagers, and now you want adults, okay, and we also have geriatric psych. Thank you, Hetty. Say a idea diagnosis and I say signs and symptoms nipa no almost swine ya no more sad behavior na they are already in the system internet and very hard to get a background. But obi wo honoma for the very first time and why all of a sudden why acutely psychotic, okay, obi ehu adrena tiafaso ebi wo honoma obi wo postpartum psychosis or wo ye wie or wo ye wie no bi enim abodam, okay, which is very, it's uncommon, but it's also common, postpartum psychosis, okay. So they want to know what happened. Oh, yeah, Nimo or your normal all her life she has been fine. Bibia, you're okay. And then let's just say you meet this patient on the street. Wabodam on a cemetery. Anaju on Shatare, temperature near 12 degrees. Jacket cry on Shebi. What for police for Obiafre police for normal number hospital. ubisa patients now, they are so out of touch with reality, say they can't tell you anything, so you don't know anything. And then finally, you know, ubisa somebody now abo obidi and I say waba ana obi I report say bia omo sister na omo yere ayira, and then notice naba na yenya. What do you think that the social worker is going to do? The social worker is going to call the family members. They say, who is this patient? The patient is this, da, 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 da. About 3 months ago, she had a baby. Boom. That is a big break. So this time, no, the doctors are almost narrowing it down. It's likely postpartum psychosis. Adentia, they told you, say, the patient had a baby 3 months ago. So that is like, you know, now we have the big, waiting 3 months ago, wawo and abodamaba. Could it be hormones, postpartum psychosis? Yes, it happens around that time. The families will be like, other than that, she's fine, she works, everything is fine. We just don't know all of a sudden. So now the doctors have something they are working with. But let's just say, ofa nipano, obi enim nipano, obi are reporting a missing. So you don't know anything. Maybe I be say every crampona or menu for into no on breastfeeding and a new for ebi so and you be as one new for as for be an edges or breastfeeding be why be more high prolactin, you know. But getting to know a background, you know, that's a good job and give us, you know, the kind of, you know, an idea of what we are dealing with and how to treat. Because if you don't know what it is, how do you treat it? Okay, so any of us can end up in a psychiatric hospital. Ebi owanuma wankasa ofele say you are not in the right state of mind, you take yourself to the hospital. But most times, no, enkrofo and omode omoba hospital. Okay, most time enkrofo and omode omoba hospital. Ain't you know? What happened when somebody? Okay, let's talk about voluntary and involuntary admission. Okay, voluntary admission, and as a Ghana, we say voluntary admission. Yes, said there one kasa nipano. Obeka say, you know what? I've been very depressed. I feel like say mujai mia medi me ho bone. Ain't no maba hospital. Na ya admit voluntarily. Okay, and no the one out do ho buy. If after obedu hospital one after also me na me say me feel okay, say me okay, me say me ko fear. Depending on what is going on, the doctors will say, okay, you can discharge you, go home. Okay. And I hear what your friend PEC. PEC, your physician emergency certificate. Okay. PEC need there. And you will pay. Dabi. So when you are down for tiho, mo bon combo. Many Jessica tiho. And I will phone so many managers say I tired 3-way your bon combo. Your bon combo, and I say, Amaka say, Sisi akra we are seeing ye me debut mo mercy. We are seeing ye me debut. You know. Now, Ama, what do you mean? I don't know. I just I don't feel like me feel I met now we are see you. I hope na me say oh Ama, me throw back sisi away. I'm also minim na dress. Na my friend, I'm when you feel see I me will feel. Na my say I'm me throw back. Na me the phone not to so. I meet me friend 911. Na my catch 911 say me wa down for bi. Your friend baby I'm over Florida. Na dress ni. Me nene kasa wo phone so. O see we are saying yene de. On person obetina we are see biom. I am at fear. She say you also the upper ice cream or if you're waiting ice cream or oh dear. But one is a dynamo boom, police open. Adanya, your friend wellness check. Adanya, police force say we got a tip from a concerned friend. We got a call from a concerned friend stating that you are making SI. You are making SI comments. And it say woke can send me as unya obedu umuboni obesha umwakomfo. Ama say why no in the police for ne ba fie no ma ebi omobaye no omaba beto say ama te ho ice creams in him or share Netflix and chill. like the dressing in the BBI okay. The police for the bear says say ain't it no thank you. Obi also person okunu hu na odi ice cream. Na osha Netflix and chill. Wa dress kama. Ni fear ye kama. Ubisa na sema oyiwa no kama. Into the police at that point, police for be making assessment. I should say, tip no munya any presentation no. E fana. Into met me bizarre say, what make you comment be say, be a winya ubeku wana. I must say, Messi no gas asem ni chewana. Messi dear, blah 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 blah. So the police can actually assess over there and determine say omunfa wonko against your will, and I say maybe it was just a loose comment, okay, no more jail. Nemo police for ne buy no baby ama omo bi board dan na ama bi dan no ama fie honom basa unhu say ama ondware ye waye ne ho basa ne tiri waye basa na tare e hye no omo bisa na sama o make eye contact no omo like ni presentation ni fie honom and your my all over the place near idea omo bisa na sama no to top up or make eye contact the police for say unim at this point. So for them to take you to the hospital, sometimes it depends. And as omo do hono, omo we say I'm at the knife, bebre was spreading knife. Your friend is saying, ne countertop so. Ye nim say knife there. Oh yeah, there be here knife 1 or 2. Now then a knife bear 3 or 4. E go countertop so. E be a bleach, okay? Bleach. E go kapum. And I say it told the honum. No, at this point there. No. Nope. And then they are buying kawa down. Say, oh boy, yeah, for we are the woko. And the police will tell you, say, we don't feel, say, we are safe. We don't feel, say, we are safe. So at this point, we want to take you to the hospital. And no dear, on to me, say no. On to me, say no. And the no dear, yes, wow, she police car anymore. Win. Now you're the one brem. Okay. And no, na omudu honoma. Police for no can't. Asema omo buy no omo nya call. Omo nya call ne buy no. The omo buy omo di wonu be hu ye no. Won't safe. They won't wait for something to happen before. They feel like you are not safe. Omo be can omo call ye no. Ukita ahoma rope. What the rope ne ye den? Okay, what the rope ne ye den? And I say, oh buy no the belts. Omo buy now. I'm at the belt too. Oshe knife down, but okita belt mienu. What the belt in here then? Police for say, Obi a oshe night gown there. Okita belt. What the belt in here then? And ahoma like into omo hu enyoma bia utimi use edisha ho akonfolia and they are like obwa ye do beko. Okay, then they bring you to the hospital. Sano so omo ba na ye bisa o so opeso okun hu ana. Now ka say dabi. If you are betika say no ni ade, but because of nyoma omo ye no and nyoma and omo ba ye no wa fa edro ombemba na endro bebre esi counter top so aden about endro bebre esi counter top so sa and I wish she edro ni bi krego cap something like ade bi a we omo hwa obetumi de edi wo ho bone no de oboa and dey friend peace say ye do ba de a peace minimum a last up to 12 weeks. Then they're gonna bring you to the psych hospital against your will. Against your will. Against your will. And 2 ways, okay? And you're careful of in some way and on your my okay? Obi wa hono ma otimi friend mami. Na waka che no mami say. Mini wa hwa me mba ne ye mami why? Mini wa way upaway to kwan da be won't kwan na ada na wo like comments be a be make na wa freeway me ni wa me de me ba we jaw and I say me was kabi e wa ha pin number ni say I didn't know all of a sudden can o bank account ni o pin numbers akire me. Okay, and I be over social media e be what they do it on social media most common omo throw a friend SI notes they write SI notes. Ewo me can't word in here. It's so be shane ho akomfo. Me can't word on TikTok for block me. You know, amok friend SI note. Of course social media, internet so now I control letter, a whole letter. Sa Inti eno sa na your concern when they call and they bring you are staying on PEC. Okay. Obiso wa they are just being omonam and omo to omo being disruptive, omo ko and I say and also police for forward no mo say adwene nko ya and ye do over a PEC. Okay. So the PEC, when you come to the hospital, like I said, PEC usually lasts for 14 days. Okay, 14 days. Say, young funny say, doctors ne edo buy, police for edo buy, no, usi ye, peso be ni ade. But ye do buy, hospital, yema we duania wundi. Uda musa, ye can say, groups groups are coping mechanism ne unko groups person obey jare no and they see ade de enya dia yama we draw so a wonfa why you so depressed movie won ya hwe dia then at this point the doctors and I say any more of depressed and I say you do buy no afede o konto kwa kakra bia na wo de on say bo ade wo say yama we draw wonfa de bia na wo code ni ade there and they now peace in there. So the doctors still have 14 days to decide what to do with you. Okay. So but the 14 days in there, sort of liberty kakra. The only thing is say on discharge you my own coffee. But the sad behavior no ekoso say and your kakra na wo ku na wo ye de na wo kese wo can words be na wo yi hu ni ade there. Your ma won draw na sa one fa. Yama wondro na sa wamfa ye wondro menu a ye de ma patient ye wo endro a ye de ma patients to calm them down to say wo kun wo ye giride wo don say bobo ade ne ade ene de ye friend emergency medication and I say PRN as needed medication eno de say ye de ma ona say wo so wonje a ye be for so na ye de awo depending on what is going on. So wo say no ma wo bobi wa no de ni ti bo ade no wa bo we no ye say oro ne ho eno de say the man na say wo so wonji a ye code you nkrofo security ni ade bebreba ye code you ye kan wo sha akondwem na ye de pane na wo. Okay, ena ye wo indra ye de be ma wo ena ye wo ade na do fear asem my husband is not around so I found way my husband is not around I found way. Ya boy 11 ewo ho no ma wo Ghana me wa brochire ya boy 7 wa e fa ho be. How did you know say me ni me kunu ye wi de ye be ya ansa na ba betena edi anadwope na yedi ho anadwope na yedi ho ana me kra me mpa anadwo de me mpe daytime tira me mba no mo nim da ho no mo amudi mu ho anadwo no mo wo ana mo mba ho mo nim nda ho me mba no o mo nim da ho because me di me ho de me ye adwuma night inti me di happen during the day. Do fear some ain't no and I wo endura. Okay, ye wo endura ye de mawa and on na ebe boa adwen no na adwen no a correct it adekwa you have to understand say obi be exhibiting signs of abodam and abibisa no a lot of neurotransmitters and your ma SSA edi working my adrenaline ye juma no yeah na say atochi. Okay, atochi. Yes, what happened? She did what?
She did the phone.
All right, I'm gonna finish this in 15 minutes. Okay. All right. You know, you guys are doing atochi, and because neurotransmitters, depending on the diagnosis, na nipa one. Okay. I yet whatever is happening, so they have to give you medication to kind of help fix it. Okay, in this in drona and the yede ma na your friend antipsychotic na ebe boa a fix it and psychiatric in psych indro it doesn't cure yema obinya adwumu ya na yema ne drona edro no ensa yare ani mfiri ho eboa no ma ade na atochima no e correct no ma ema wutimi ahwinye but the interest yare no ye tu aseko. Okay, Into no psychiatric medication na yede be ma na ebe correct na ebe ma wetimi function no sa indro no ene dia emergency no wo ye gidigidi na wo ko ana yede be ma no two different ebi o why the same indro depending on which one the doctors like but dia yede ma wa eboa sebe adwemu yare no ma adwen no aye edwuma no se yede ma na se wo se wonje yede ma na se wo se wonje a eno no ye ntimi enforce o emfa enwo dia ye be force wa ye be wo ye dia wo ye gidigidi e kasa kire wa wo ntie ni ade ene dia ye de be wo okay Ghana me kasa lagatin ni ade okay enti no say ye draw ni mouth say bia obi wo bipolar right or mania or gidigidi onda or kasa ori or jampe na ya man ye draw bit say Depakote okay ya man ye draw bit say Depakote but all the Depakote ni mana o si onje enti say oye gidigidi na o say ade ni ade a ye betimi awo no Ativan, Haldol, Benadryl and there a emergency medication to come way but Depakote na boa ma ni mood na nkasa no a balance na ye stable ni de yintimi force emfa so so yompa enti sa no e de na ye be ya nipa ne be ye ebe fa ndro no na doctor ne de wo court ai doctor ne de wo probate e fa be probate court in the probate court no doctor ne be throw letter tin say patient ye de yete ha ye mpese patient kra beba ye besa yete na ha no hutua ye nka e no mo di patient ya brese patient na wa ro ne ho ene nam honom adwen no atochi oyewe patient ne ba hospital ha no ye man edru a ebeboa na e bia ye ni history that I saw bipolar ye man Depakote na osi onje onum enti no oye gidigidi na so okun na so obobo nyoma na ose nyoma na ya wono parents no eno de ye hia lawyer ye hia judge ye hia obia ne de be wo ai hia doctor pe na be trauma ai eno so de hia na be ka kire no de aye pe na wa tro de amai ai ene ye me enti no doctor ne be ka say but de aye de wo no na ama wa calm me down ne de after 4-5 hours na e fini system ne mu okay ena sa endro na yede wo omo ma omo ye boko no you know yede because yede wo omo ma omo da ninti no eya entimi mma omo nko groups ni ade enti bia na omo aye bosa but yem pese patients de bia na patient why it is a friend snow you snow omo you can say we snowball them yem pese de bia be snowball omo it's a snow embre ya pese ye be snowball mo ya pese omutimi adwene ye adwuma no mo function no mo tumi kofie omo ye omo ne omo ye okay enti no dia ye de be ma omo a enye snow mo na bada be ma adwene ye adwuma mo mpe enti no lawyer doctor ne tro sai we na no the court na court na ma patient ne lawyer okay enti patient no ho na lawyer na ba say oye wo lawyer sa lawyers no Oma specialize in you know adwemu yare ni ndro ni ade okay into bon say lawyer ne beba ebi o wa patient ko ma no say your lawyer is here so you should get the fuck out of here omunfi say patient ne be say oye involve lawyer ne ba oni ne be kasa the lawyer is there to advocate for the patient but ebi o wa patient no kasa mo lawyer na ba kra o mo serve o na kasa lawyer na ba kra lawyer no ko omo did lawyer na tem class in judge okay it you know and because they are in the side hospital na a lock unit omo ntimi mpie nkomba no it there's a lawyer no oba ho no it lawyer ne ba we ka say hey listen ndro na doctor ne dey ma no adenti na one person obe fa ndro no ebi o wa patient mo kasa say ndro we me fa ema me didi too much enganga na bi say Depakote and adwemu yare ndro no that's the truth o fa omo fa ema omo didi edro we me fa me didi too much intina eya me wo fia me mfa no okay na okay inti lawyer need to make a doctor and say okay or say Depakote no or fa odidi dodo inti ade na won change Depakote na woman lithium okay inti no omo kasa na doctor and say okay only any allergies to lithium and any product okay ya be man lithium na ya sesa Depakote na bia yen lithium ya the lithium no so ma wo fa over so lithium so onuma onum nsi ododo nti onfa ohun inti no na very there na doctor na say okay ma try my sister you draw no a umfa u behavior no so a enye papa o kasa o ponchi ade nti no unim sisi ade there's nothing they can do na afede de judge na she date ama be 2-3 days patient ni behavior no and sisan pania or brown or bro ye on psychiatrist hospital na judge na o map she date na judge na ba judge ne ba na ma ba be hwe note na ye troni na how many times a patient in Yemen ye one Ativan ne Geodor ne Haldor ne all the PRM medications the other one on near there na afraid that ni behavior and then cameras also honum. So if the judges are not convinced that ye can patient in Nashimwa yena ye ka also ye ka adwuma asem also be ka okoti asem na wa adwina ye adwuma okoti na be yimfa who is cutting what is cutting without that dream my shine ye and the obi endin ho ha and ye ka adwuma asem wo ha no enti no say your friend is saying say lawyer no ebi wa patient bi wo mutimi advocate mo say they are lying blah 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 enti no say judge ne pa okay na omo yi camera na kire no na wo hu patient no obi wo na wa run the draws so everybody come sack this pussy like the thing, kind of things that they are doing the judge nangasa see it for themselves na judge nanga say okay my decree is that a drobi adebema obia psychiatric a drobi adebema obia okay nyebia doctors ne can say a bia ye bema o Depakote 1000 milligrams every day for your bipolar and the judge no yana judge ne dey abo so say time. Okay, na judge no why once I judge no obeka say wa probative patient no for everyone say Depakote 1000 milligrams no say patient ni po on po or like you unlike you as a sort of a drone. Okay, but the doctor have to be very careful. Say doctor ne wo any adjustment as a so make sure say wa kama e wom say ebi wo na say doctor ne probate patients no on a Depakote pill. Okay, pill. Na doctor ne ye mistake na doctor ne ye throw liquid patient meeting aga say on pill liquid no and nobody ya na dey lose kakra yetimi esisa but say bia doctor ne probate patients no on Depakote na bia judge ni probate patient no on Depakote na doctor ne koye mistake no ko throw lithium patient need to be refuse say enye sa na work court probate order no. Okay, so ayana we are very careful the kind of endure ye omoko so say ye Depakote 1000 milligrams a day. Okay, judge ni probate patient ni say omo the decree ni but the patient no abo say bailiff no ba no omo the decree na ba omo to me say patient say you have been probated to take medication. Okay, into wumpo say the pill ma patient na say 1 year you want a panic. Okay, and it's a 1 year lucky na say we draw na twice a day and a pay the man na say 1 year e be free code na ya wo panic and you draw the man 1 year be free code na ya wo alternative e draw na ya dey wo and you want say be wa patient no first couple of days no 2-3 days no ombeko na ya code say afi de won say omhuna mu ni ayo and what we say I am so 3 ml pan na wa I pan ya de walk intramuscular no so de ewa enti no bon say ya wo mo pan sa bon say omo na ma no mo timi peja omo sa omo sa ni ade ni na ye omo ya enti bon say afi de miss I no me kwa me say I have the pill and I have the injection. The choice is yours. Which one? And be wasting me time cry. Me no ni judge their shim enti de na ope. Obon say afi de almost just give me the pill. Say sano swa say the mom ye will order for mouth check. As I say ye pa no ye show money. But it's so funny. So person who say patients wako jail da. Okay. Patients are who say wako jail da without you even knowing no. The moment I'll be more draw, ya wasn't one my say. Because in prison, your mom will dry a check you. Psych so yes sir. Only when we suspect say patients no on fire drone. Into psych won't mean fire drone my patient na wonder no. As I would now na me which is 1 minute. Okay. But omo mako prison no, especially omo de mobile 3-4 years no. I check into a part of them. Into more my dear, you are more sure when no man got on my mouth check. Into that is how you know. So they have been into almost all my prisons that tells you like right off. And you know, on my property on the yana order for mouth checks. So now I check home because some person be drone now on with me hide. And a bit so why you suspect say the mom will be a muko coffee. Yeah, the one why you order. To be call them for more than 30 minutes. And the psych hospital, they be why to me lock old dying cry, copy me. Everybody to me lock old dying during the day, depending on what is going on. Your order, you can go to your room by yourself. And I remember 1-on-1 hour show. Okay. Ain't you know, say, Abia, almost a drone na faded there. Doctor near lab, na so who say, okay, your friend will be therapeutic range. See, Abia say lithium, or do therapeutic range, and I Depakote or do therapeutic range. Now Dr. Naka say, okay, this is the offer. Because the truth of the fact is that some of these patients you cannot force your mind. At the point you will discharge them. I saw more called long-term care. You know, once I feel obi also onim says so fair drone no kono obefa a drone because they want to get out of there. Into said, give me my medicine. Sa a drone na doctor a judge approbate no. Se patient nada sen kra ese se wunyane na ode mano. Se one farmer na wo na webu judge nembra so. Se ebi wo wa patient bi wo ho no ma yetimi snow bomb because of omu behavior and no. Yetimi snow one na omo so drowsy. Into bones afraid and ajo de depa kotini komo omo bi omo no a MBA. And say wo friend doctor na doctor natural letter brofu no o cheche mu judge the reason why. But other than that, no. So who cry say we decide to make sure say we dey assure me because a judge and a order. At this point, na your doctor na a judge na order. Okay. Ain't you know say for a drone na afraid your behavior na improve sana. Once na doctor no what discharge you. Ebisu owa judge doctor nebeka say, hey doctors na mutu many patient na 3 months so. Ebisu owa doctor nebeka say offer a drone all right. Nenso ni behavior and nyoma na all ye no. Said your buy net ye who improvement via home. Now doctor na sanso file, you know, a commit to stay and approve to stay. And to our patients know now bailiff need sermons na ba say. Judge doctor na sand the work of court biom say fa we drone. But behavior no and society or that so kasa or higher you or boy or young or threaten California there. Now you're committed to stay. Ain't no and also judge never not judge need the abeshuma mom says now or committed to stay for 2 months. Now you're committed. You want to mean coffee. Now what now for 2 months? The 2 months of behavior and society, yes, I'm to me the okobio. The more I will come, the longer I will stay in hospital. Okay, go shower. What do you have? Okay, go use the bathrooms. I'm ending. Okay. Ain't you know that is 2 ways that your committee patients. Okay, but so biba sort or you depressed, and another way so to me committee patient. Obiba so why you so depressed, on feeling or racing thoughts or feeling on you okay, now you're admitting about voluntary on one pen or the buy. Nemo mobedu on your manna or your no and for queen someone okasa, and some okano and some near basa. One also one I'll buy doctor need to me file my committing. Even though about voluntary, but so behavior very weird na say who exhibited psych where doctor to me file am your committal. Emma will stay. It's me file committal. Emma offer a draw. Okay. In say voluntary is all banners also on fair drive voluntary. That's any behavior anyway. It me discharge your monomoko. Okay. So yeah, be end what I say. But we are very careful. We are very careful in your mind, yeah, Becky. Ghana for the we can get away, but only abrofu. And now you know abrofu. Now only your motor say. Okay, can't say me say minya me kumi ho. Minya ebi ase nyam de. Minya me dwane akoka mu na car bomb you. And I say and out to because wo me kun like you know sa ne man enya nkwa utimi so ka say obi kun obi so eno so say be end in prison. Okay. Yeah, you know these are some of the 2 ways the committee patient. Okay, we shall continue again tomorrow 7:30 above, so I don't want to adiasa. So thank